Hello, everyone. Welcome to LAMP Basics or the LAMP TCM 101, LAMP TCM and Acupuncture for beginners. Let's start by having our first presentation by Ma'am Needs You, certified acupuncturist of Silang Cavite. Good afternoon, Ma'am Needs.
Good afternoon, Doc Hector. Good afternoon, everyone. So, topic for today is diagnosis by palpation, okay? So, let's go to skin palpation. Palpating the skin involves focusing on three major topics. Number one, temperature of the skin. Number two, moisture of the skin. Number three, texture of the skin, okay? So, how do we do this? By three different methods. By touching, by stroking, and by pressing, okay? So let's go to palpating the body. There are three different palpation techniques. One is touching, light touch of the patient's skin. It detects the temperature, moisture, and sweat. By stroking in the skin and deeper tissues of the patient. It is usually carried out in chest, abdomen, and limbs. It determines presence of tenderness and swelling, okay? So by pressing relatively hard to deeper levels, okay? It is usually done in the abdomen. It determines presence of pain or masses, okay? So key things to know, the temperature, subjective feeling of heat does not always correspond to the objective feeling of heat of the skin. If the skin feels hot to touch, it often indicates damp heat. If it is cold feeling, it indicates cold pattern. It is often felt in loins or lower abdomen or lower back, which indicates kidney yang deficiency, okay? If it is hot on the first touch, ceasing to feel hot with sustained pressure, it indicates wind heat invasion is still on exterior, okay? If the skin over vessel is hot on medium pressure, but not on heavy pressure, it means interior heat in the middle jaw or heart, okay? If the skin is hot on heavy pressure, nearly nearing the bone, it indicates empty heat from yin deficiency, okay? So key things to know, moisture and texture, okay? Moist skin may indicate invasion of exterior by wind cold or more commonly wind heat, okay? If there is moist skin with absence of exterior symptoms, indicates spontaneous sweating from lung qi deficiency, okay? If there is dry skin, it indicates blood or lung yin deficiency. If it is rough, like skin, it may indicate painful obstruction syndrome from wind. If it is scaly and dry skin, it indicates exhaustion of body fluids. If it is swollen skin with a pit left after pressing, it indicates edema. If there is swollen skin, no pit, indicates retention of dampness, okay? Let's go to limb palpation. Key things to remember, hands and feet cold to the touch, it indicates yang deficiency. If the whole arm and leg feel cold, it indicates kidney yang deficiency or empty cold. If there's only forearm and lower leg feels cold, it may indicate interior cold from chi stagnation or full cold. If only the hands and feet feel cold, it may indicate chi stagnation. Okay? Remember po niyo yan. If the limbs feeling hot, indicate the heat pattern. If hands hot on the dorsum, it indicates full heat. If hands hot on palms, it indicates empty heat from yin deficiency. Okay? So that's it for today. Thank you very much for your attention.
Thank you very much, Ma'am Nits. We proceed to the second topic, wood element, and let's welcome straight from Rizal, Ma'am Teresita Sumile. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector. Good afternoon, everyone. Wood element, the concept. Now let's talk about wind symptoms, excess liver wind or qi. When liver qi rises, many Yin symptoms may occur. First, wandering symptoms like dermatitis and rheumatism. Second, irritation symptoms like sneezing, itching, tinnitus, photophobia. Third is paroxysmal symptoms like epileptic fits, colic, or paroxysmal pain. The last is wind block symptoms like hemiplegia, facial paralysis, and stiff neck. Okay? Now, interior liver wind can rise due to stress, alcohol, excessive intake of sour foods, or excessive eye strain under artificial light, like computer games, working indoors for long hours with brightly colored lights. Then, liver young excess can cause liver wind to rise when there is a blood deficiency. When the yin aspect is deficient, the yang aspect tends to rise as there is not enough control. In the case of liver, if liver yin is deficient, liver yang or heat tends to rise more often. And when liver blood is deficient, liver yin like movement, restlessness, irritation tends to rise. Liver yin and yang could be high at the same time as well. Okay, so here it is shown in our tower diagram that there are two causes of liver yang to rise from time to time. I'm sorry. Liver yin deficiency causes liver yang to rise from time to time. And then liver blood deficiency causes liver yin to rise from time to time. Okay. Now let's go to treatment for wind symptoms. Usually, if the wind symptoms are localized, this localized area is treated. There are some very effective wind elimination points that can be used to eliminate wind from different areas of the body. If the wind symptoms are extensive, then it is necessary to balance the liver. Liver yang sedation, sedate gallbladder 38, the sedation point of coupled young organ, liver blood tonification, use all the points given on page 392, adding point liver 5, the loop connecting point, which tonifies yin and sedates yin. So we have here yin eliminating points. Gallbladder 20, forehead and face. SI12, shoulder and arm. UB12, back, lung and skin. GB31, hip and leg. Buffing, 8 wind points of feet. Liver 2, stomach 44, GB 43. Baxi, 8 points to remove harmful energy from hands. Now, in case where active liver wind has blocked the energy flow between the left and right sides of the body and produced an equal muscle tension on either side, like spasticity on the one side or flaccidity on one side, the liver gallbladder meridians need to be unblocked. So energy can flow through from one to the other side. To learn how to do this, see the special techniques on page 435. Okay. Liver controls strength and tension. The spleen nourishes the muscles. For large and strong muscles, the person should not only train, but also feed their muscles with proteins. This aspect belongs to spleen nutrition, the blood and yin aspect. If spleen nutrition is deficient, the muscles will be small no matter how much training is done. The liver qi, the functional yang, governs the strength and mass tension of the muscles. When qi is deficient, the muscles are weak and flaccid in general. The flexes are low, the sphincters do not function well, and blood pressure tends to be low because the blood vessels have a low tension. The person is unable to do heavy work requiring muscle strength. When liver yang is high, the general muscle tension is high. The person is tense everywhere, like colic in interior organs, bronchospasm, pyloric spasm, raised blood pressure at times of stress, and increased reflexes, and others. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We now proceed to the third topic for this afternoon. Let's welcome Ma'am Lynn Galarita of Quezon City. Good afternoon, Ma'am Teresita. Ma'am Lynn.
Good afternoon, Dr. Hector. Good afternoon, everyone. So our third topic is wood element diseases. So ano pa rin tayo, liver and gallbladder. Okay? Among the most common diseases or illnesses na na-encounter natin ay headache. Not all headaches are related to liver and gallbladder. But many headaches, especially those that come on with tension and stress or with menstruation, definitely belong to the category related to these organs. However, we use this opportunity to discuss various other types of headache as well. One could have a simple treatment plan or like a cookbook, not one involving energy analysis, and for all headaches as follows. Ito yung mga pwedeng gamitin na points sa iba't ibang klaseng headache. So we can use local points, around 2 to 3 points for this. Or we can use area distal point, that's LI4 or lung 7 if it's in the occipital, if it is an occipital headache or yung nasa bahaging likod. Or we could use symptomatic points for headache. That's gallbladder 20, or the symptomatic point for nausea and vomiting, that's pericardium 6. Or we could use the influential point for muscle and tendons, that's GB4, if it is a tension headache. Or we could also use the influential point for marrow, which is gallbladder 39, if a nerve pain, or it's an all over the head na klase ng headache. Or we could also use the influential point for the blood vessels, which is lung 9, if it is a pulsating pain. However, one can improve on this a great deal. That is, we need to treat the meridian or the area of the headache, the nature of the headache, and the cause of the headache. So we need some answers to the following questions. First, kailangan natin itanong, where does your headache occur? Saang bahagi ng ulo? Sa forehead ba? Sa gilid? Sa occipital area? And then, how would you describe the pain? Is it throbbing pain? Pulsating? Pwede bang distending pain ang nararamdaman? O iba pang mga klase ng sakit? So, another thing we could ask, does it start slowly or does it worsen quickly? Tapos, what could bring on your headache? Anong kadalasang pinagsisimulan? Ano yung mga factors na pwedeng pagmulan ng pagsakit ng ulo? O what makes it better? Anong nakaka-relieve o nakaka-alleviate ng symptoms? So how often do you get a headache? Gaano kadalas? How long have you had your headache? Kung gaano nakatagal yung pagsasakit ng ulo? So, pag natanong na natin to lahat, pwede natin i-analyze. Are there any associated symptoms? The answer to the first question in the list above may be indicated with a finger, in which case we have no doubt as to which meridian it is on, or with one or both hands, in which case we need to go by the empirical knowledge of our ancestors as to which organ manifests pain in the areas of the head. So we then have to analyze if it is a yin dominant or a yang dominant headache. If the patient indicates a point on a meridian, for example, GB14 or stomach 8, this would be the meridian we would proceed to treat. What if the patient points to the entire forehead or the occiput? These areas are associated with the organs, which are also of the same polarity. So, in determining anong klase ng headache, we distinguish where the headache is located. So, which area of the head. If the headache is frontal, that involves the forehead, both temples, and the sinuses. This involves the stomach and large intestine. If the headache is on the side, one-sided at a time or half-sided, this involves the gallbladder and the triple warmer. If it's a vertex headache, this involves the liver and the pericardium. If the headache is in the occiput, and this could be a urinary bladder and a small intestine issue. So for frontal headaches, these are related to either the stomach or the large intestine. We have, if you need to be sure, we asked about bowel movements, hunger, and thirst, and others. These frontal headaches could also be sinus related and intestine connection. So for headaches on the side of the head, they're always related to the gallbladder, except in cases when they are around the ear, where they could be from the triple warmer. It is important that they should be one-sided at one time, though it is possible that it could change sides. If a headache occurs in both the temples at the same time, it is more likely that it's a variation of a frontal headache. So for vertex headache naman, these are associated with the liver. These are often stress-related. For occipital headaches, these are very common. This can occur together with neck and shoulder pain, with low back pain, or with menstrual bleeding. The first two, ito yung nasa neck and the shoulder pain, are associated with urinary bladder meridian, and the last two with the uterus, an organ which is directly associated with the urinary bladder meridian. But that's all for now. Join us again tomorrow for the continuation on the wood element diseases. Thank you for listening.
Thank you very much, Ma'am Lynn. Let's now listen once again to Ma'am Teresita Sumile for the metal element. Good afternoon, Ma'am Teresita.
Good afternoon po, Doc Heck, and everyone. Let us now talk about epistaxis. Epistaxis is bleeding from the nose, usually due to rupture of small vessels. This type of excessive bleeding, no matter from which part of the body, shows a far heat situation in the organ. It should not be confused with dryness with occasional blood when blowing the nose. So it is illustrated here in our tower diagram that in far heat, yin is deficient while yang is excess. In damp heat, both yin and yang are at an excess state. Okay? The body always wishes to bring about a balance. In a damp heat state, the yin is healthy and the yang increases. The yin would then contradict the yang and increase in order to suppress or control the yang increase. The symptom could be of inflammation and fluid, like cough and mucus, abdominal pain and diarrhea, stomach pain and vomiting, and there will be fluid secreted as a reaction. In far heat state, the yin is deficient and the yang increases. The deficient yin cannot increase to fight the yang, but it would be possible to eliminate the heat from the body in order to bring about a balance. So the quickest way to release heat is to bleed. The more blood, the better. Okay? Now, wherever excessive bleeding occurs from, there is a far heat in that organ. Also, there is a far heat situation in the liver because liver stores and releases blood for the entire body. So treatment, use local points, extra 1 and Li20. Together, they are called the nose triangle. Li4, sedation, and lung 7, tonification, where Li4 is the yuan source point of the young organ, and lung 7 is the loop connecting point of the organ. Then gallbladder 40, sedation, and liver 5, tonification, where gallbladder 40 is the yuan source point of the young organ, and liver 5 is the loop connecting point of the organ. Next is GB20, heat dispersing technique. And the last, spleen 6, the standing technique given to descend the ascending heat. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We call once again Ma'am Lynn Galarita for topic number 5.
Good afternoon ulit. So we continue our discussion on the vital substances. We're on the part four of our discussion on Qi. So for today, we discuss about Qi disharmonies. Qi has 4 main states of imbalance. These imbalances may affect many parts of the body at once or within a particular meridian, organ, or area. Deficiency of Qi, for example, may affect the lungs with symptoms of shortness of breath, the stomach and spleen with some symptoms such as poor appetite, and the body in general with symptoms of fatigue and weakness. So, to discuss further, let's talk about Qi deficiency. This is usually caused by overwork, mental strain, a weak constitution. It's a way Qi deficiency where one gets cold and flu easily. The problem becomes chronic, especially in old people. The organs usually involved in Qi deficiency are the spleen, the lungs, and the kidneys. Among the clinical manifestations are fatigue, shortness of breath, pale face, weak spirit, excessive sweating, tiredness, lethargy, apathy, exhaustion, disillusionment, a dislike to speak, spontaneous sweating, all made worse with exertion or exercise. The tongue in Qi deficiency has a pale body with thin coating, and the pulse is empty. So next on the Qi disharmonies is the sinking Qi. If Qi is very deficient, then the holding function is depleted and it may sink, as in a prolapse of the organ. So this usually happen with spleen Qi. Where there is spleen Qi deficiency, this could also lead to spleen Qi sinking. So the clinical manifestations, down-bearing sensation in the abdomen or prolapse of the organs. The tongue here will have a pale body with thin coating, and the pulse will also be empty. Next, disharmony is a rebellious Qi. In this instance, Qi flows in the wrong direction. Example, the stomach Qi considered to flow downwards, carrying food to the intestines. If Qi rebels, it will move upward, leading problems, especially with the stomach Qi. The clinical manifestations of a rebellious chi are coughing, belching, vomiting, hiccups, and dizziness. The tongue will have a pale body with white coating or a red with yellow coating. The pulse will be wiry or rapid. The fourth disharmony is chi stagnation. The long-term causes could be irregular eating habits, stress, premenstrual syndrome, and painful periods. This this is commonly in acute conditions like cold or flu attacking the flow of chi, causing emotional shock. This is when the chi gets stuck and stop moving. You see this mostly in liver chi. Okay, among the clinical manifestation of chi stagnation are the following. This normally includes some sort of pain or distension or stuck feeling. Example, distended or dull pain in the hypochondrium and chest, pain that is not fixed in the chest or hypochondriac areas, sighing, hiccup, abdominal distension, fluctuation of mental state, feeling of difficulty in swallowing, melancholy, moodiness, and happiness, feeling of lump in the throat, painful periods, distension of breasts before periods, and premenstrual tension and irritability. The tongue here will be normal, but the pulse will be wiry or tight. This is all for now. Thank you for listening.
Thank you very much, Ma'am Lynn. Let's now call once again Ma'am Needs You, certified acupuncturist of Silang Cavite, for the water element. Good afternoon, Ma'am Needs.
Good afternoon, Dr. Hector, once again, and good afternoon, classmates. So, topic is the water element, concept number 6, okay? Kidney governs the aging process. So, our patients will be surprised kasi minsan they often look and behave too young or too old for their age. Obviously, we do not always age at the same rate as our chronological age. If we want to preserve a piece of meat for future use, we will wrap it in cling film to retain moisture and put it in the fridge, refrigerator. Okay? We know that what keeps cool and moist will stay fresh longer. Parang isda or meat. If the same piece of meat was put on an open plate on a sunny windowsill, over a warm radiator, it would discolor, dry, and decay within minutes. Okay, remember po. It means that what is hot and dry ages faster. An example for an extreme case is progeria or premature old age occurring in childhood. Okay? When we apply this knowledge to our aging process, which is governed by the kidneys, we can conclude fast aging or looking too old for their age, hot and dry, mas mataas po yung, look for the tower diagram, yung yang, okay? Mas mataas siya. Young for the age, yung in the refrigerator of life, moist and cool, mas mataas po yung yin. Okay? So, remember po. So, it is therefore occasionally possible to diagnose the state of kidney energy just by guessing someone's age and checking how far our estimate was from their actual age. It is also interesting to observe that a person can age rapidly within a short period of their life during illness, bereavement, or menopause, and how they become younger looking if they are happy or are more relaxed. Remember, so kidney dominates reproduction. Reproductive system begins to function at puberty and continues to be active until both female and male menopause. However, it also functions before and after this period, even though it does not have the function of reproduction. Reproductive organs are nourished and energized by the kidney and urinary bladder and the earth and metal elements. Kidneys and urinary bladder are the two only organs of the body that have two very different functions and two different mother elements. The kidney governs water and all its functions, and the life gate or the Mingmen kidney functions mainly with the reproductive system. Remember, the earth element nourishes the reproductive organs, and the metal element nurtures the water element. Okay. Let's go to the kidney. There are two parts, two kinds: water kidney and the life gate or the Mingmen. So under water kidney, there is urination, dryness, edema, bones and joints, head hair, hearing, physical energy, physical endurance, backache, knee pain, fear of water, fear of physical work. It is nourished by lung and large intestine. Okay, yan po yan. Sa life gate naman or the Mingmen, it is the kidney, fertility, libido, menstruation, puberty, prostate, uterus, pregnancy, sexual power, sexual performance, sexual manipulation, fear of contact, fear of sexually contacted takot, and diseases. It is nourished by the spleen and stomach. Okay? Remember po yan. Screenshot na lang. Thank you for your attention, everyone.
Thank you very much, Ma'am Nitz. We call once again Ma'am Lynn Galarita for the Meridian theory. Good afternoon ulit, Ma'am Lynn.
Good afternoon, Dr. Hector. Good afternoon, everyone. So let's continue our discussion on the Du Meridian. Okay. Let's start with acupuncture point Du 1 or GV1. This is located on the midway between the tip of the coccyx and the anus. This is the low connecting point of the meridian that connects to the Ren meridian and increases the yang of the Du meridian. Next point is Du 4. This is located on the posterior midline below the spinous process of the second lumbar vertebra. This point is also called the gateway to life, and this point is situated between the back shoe points of the kidneys and treats infertility and erectile problems, especially in men. This is used together with UB23. Next point is Du 6. It is located on the midline below the spinous process of the 11th thoracic vertebra. This point is a good point against tension in the back and muscles and is used in opisthotonous and epileptic fits. Next point is Du 11. It is located on the midline below the spinous process of the 5th thoracic vertebra. This point is situated between the back shoe points of the heart, and this is an excellent point to treat concentration problems, and it is generally used along with bladder 15. So here are the pictures where the Du meridian is located. From Du 1, we have Du 3 to 5 along the lumbar area, lumbar vertebra. And the rest from Du 6 to Du 12, it's in, and until Du 13, it's in the thoracic area. Okay. So next point is Du 14. Du 14 is on the midline below the spinous process of the 7th cervical vertebra. This is the meeting point of all yang meridians, and this is an immune enhancing point. Next point is Du 20. It is located at the junction of a line connecting the apices of the ears and the midline. 5 soon from the anterior or 7 soon from the posterior hairline, respectively. This point is where 100 are at conference. The point is an excellent tranquilizing point and is suitable for patients with sleep problems, obsessive nature, and for those who are too much in the head. Marami masyadong iniisip. When given against the direction of the meridian flow, it will give a sense of tranquility and detachment. Care should be taken not to use this point on patients who need to drive long distances after the treatment, as they could be disoriented. This point can also be used in the direction of the meridian flow with the intention of tonifying the yang in the mind. This would be a good treatment to improve concentration and mental capacity. Okay. Here's the picture where from do 14 to do 20. Do 20 is on the top of the head. Okay, thank you very much for listening.
Thank you very much, Ma'am Lynn. We now proceed to our last topic, still on chronic fatigue syndrome. This time, we discuss the lesser yang pattern. Exterior wind heat or wind cold can sometimes lodge itself in an energetic niche that is in between the interior and exterior, and this is called half exterior, half interior in Chinese. In the scheme of the 6 stages patterns, and specifically of the 3 yang stages, the Taiyang stage is the most exterior, the Yangming the most interior, and the Shaoyang or the lesser yang is the hinge between the two. So we can actually compare this with a door. Okay, the hinge is the lesser yang, and bright yang, which is at the most interior, while the greater yang is at the most exterior. Sometimes exterior wind invades the body through the greater yang stage and then lodges itself in the lesser yang stage. When this happens, the pathogenic factor is trapped between the greater yang and bright yang stages. It somehow bounces back and forth between the exterior or the greater yang and the interior bright yang. When it bounces towards the greater yang, the patient experiences aversion to cold. When it bounces back towards the bright yang, the patient feels hot, subjectively hot. So here we have an illustration that actually shows us the pathogenic factor in the lesser yang. So the more if there's a tendency towards a greater yang, then there would be more of aversion to cold. Okay, and there's a tendency towards the bright yang, there's more aversion to heat. The lesser yang pattern also exists in the 4-level scheme, and it is called the gallbladder heat. This is a pattern occurring at the chi level, and it is essentially the same as the lesser yang pattern. So think of the gallbladder heat as also the lesser yang pattern, except that it is characterized by heat rather than cold. The main clinical manifestations of this pattern are feeling hot and cold in alternation, fullness of the hypochondrial region, poor appetite, irritability, dry throat, nausea, bitter taste, blurred vision, white sticky tongue coating on one side only, and a wiry pulse. These symptoms describe the lesser yang pattern of the 6 stages. In the context of the 4 levels, the pattern of gallbladder heat or at the chi level is basically the same. The only difference being that it is characterized by more heat. Thus, there will be a prevalence of heat sensation, and the tongue coating will be yellow. From a channel perspective, most of the lesser yang manifestations are symptoms of gallbladder channel heat. So there will be fullness of the hypochondrium, dry throat, nausea, bitter taste, blurred vision, wiry pulse. The pathogenic factor in this case, the heat, can remain lodged in between the exterior and interior, specifically in the lesser yang, for a long time, months or even years. This happens when the person's body condition is particularly weak at the time of invasion of the exterior pathogenic factor. Both residual pathogenic factor and latent heat can assume the form of the lesser yang pattern, which is part of both the 6-stage and 4-level patterns. And though this is not really a third separate way in which chronic fatigue syndrome can manifest itself, it has such special and defined characteristics so that we need to discuss this separately next time. Thank you very much for joining. We hope to see you in our next presentation. Thank you, everyone.